Hello and welcome. Today we're going to do an introduction of the care plan, A Path to Comfort for the hospice patient. We have Brenda and Nancy here today to introduce us to their booklet. This was a booklet developed along with some personal care videos that they're going to share with you today. And it was designed for the patients, their families, and the hospice team so that everyone can have a seamless, compassionate experience in hospice. So today I'd like to introduce you to Brenda and Nancy. Brenda and Nancy are both registered nurses with a bachelorette in nursing science. They are each nationally accredited certified hospice and palliative nurses. They hold over 40 years of hospice experience. They are also full-time case managers working for hospice patients currently. The years of extensive education and direct experience at the bedside made them experts in their field, and they also serve as mentors and educators of nurses, students, hospice volunteers, and the community at large. They teach senior level nursing students in the university setting, and the care plan is used in their geriatric curriculum. They are also associate members of CHAPCA, and we are proud to have you with us today. And we'll go ahead and turn it over to you, Nancy and Brenda, and you can share your care plan booklet.
Well, Sarah, first of all, thanks so much for including us and asking us to share our information today. As Sarah shared, we have been nurses for a long time at the bedside, and this booklet was inspired by our actual practice and our recognition of the ongoing need for life education and support through the end-of-life experience generally in hospice care. It is really just a nitty-gritty for hands-on care that is needed at the end of life. And it can be seen actually as a crash course in hospice care. You can use it as a tool for training RNs who are new to hospice care. And we're finding in our own company and in others that it is standardizing the practice of your nurses that are practicing right there at the bedside.
Nancy and I have immense respect and admiration for the seasoned hospice members that we work with, and also those that are new to end-of-life care, and there's a lot of them. And we have really realized this is really a recruiting and training tool for nurses new to end-of-life care. And it also stresses that the end-of-life care on hospice is a complete interdisciplinary team. It takes all of us, the social worker, the aides, the chaplains. It's a team approach.
And as you'll see as we go through the booklet, that our motto, the way we practice, is that care is treatment.
Yes.
And so as we review the booklet, we're going to give you tips on how to utilize it, how to introduce it to the family, how to actually introduce it to your staff members who are going to be using it. This webinar is not we are not teaching you how to provide hospice care. You already have very experienced staff that are doing that are taking care of patients. This is, we are underlining the booklet and how it will save your hospice time and money in your caregiving.
Saying that, our hope is after the New Year is to do another webinar, a 90-minute webinar, actually teaching symptom management and end-of-life conversations based on our booklet.
Yes, we are definitely looking forward to that. And I wanted to point out to our audience that this is much different than the first original booklet that you had. Originally, it was called A Path to Comfort. So can you tell us a little bit about why you rebranded and renamed the booklet? And this is a picture of the original version.
And many of you may have seen this because we sent it out to anybody we could get an address for. Nancy and I did the graphics and design and everything in my kitchen, not knowing a lot. And we really heard that it needed a better visual punch. And so we took that advice and we hired a business consultant to help us rebrand it and make it more visual, which the new version turned out absolutely beautiful. But during the process, this business consultant said, "You keep talking about the care plan." Well, Nancy and I, being seasoned hospice nurses or nurses, we use the care plan as a living document. So we decided to change the name to the care plan, A Path to Comfort for the Hospice Patient. And it was also Sheila Clark who pointed out when she saw this first screen version that this is a care plan. And but our organization stayed the same, which you'll see how we've organized throughout. And it talks about symptom management. It goes over med management, each major symptom, what transition and active dying looks like. And then throughout the booklet, there's videos, which are, have been extremely popular. And the care plan is designed to be the centerpiece for the care in the home.
Wonderful. And how does the booklet get into the hands of the patient and the family?
Well, our goal and the way we've been using it, we feel the very best way is to have this booklet in your admission packet. So that person, whether it's a nurse, a social worker, has that at their fingertips as they are going through the actual admission process. We don't go through the whole booklet at the time, and we'll talk a little bit more about that, but we do expect that it's best utilized and introduced right at the very beginning, and as I said, as a part of the booklet.
This would be a good time to go to the first 2 pages, Sarah.
Fantastic. Okay.
And the reason, just again, you can see the change in the look of the booklet, but we developed this originally and then again rebranded it because we were really seeing that there is not any that kind of document that's available to the hospice patient. This need was not being met for the patient or even for us as nurses. So that is what we actually set out to do, is to brand this booklet so that it be very helpful at the bedside and for all of us who are using it. You will see throughout the booklet, and we'll highlight it, that it is organized very consistently, that every page, depending on what we're addressing, has a goal. What are we trying to accomplish? What do we know about that particular problem, and what can you actually do about it? There is also room for individualizing the care that case manager is going to write down, or a family might jot down questions for the next visit. But you're going to see that this is consistent throughout the booklet.
And I think what happened as we wrote the booklet and we got it into print, then and the videos became a natural organic thing along with the website.
Exactly.
So Sarah, if we can move on to the next page, the next 2 pages, and the title is About the Dying Body. And this is a great introduction into the hospice world, because in About the Dying Body, it talks about the body does know how to die. It's meant to die. And it has language that is soft, but yet they can understand and absorb it. And then under how much time is left?
Yeah, question that families always are even a little nervous to ask.
How much time?
How much time?
It's a big question. And I think that we want to take any guilt away from asking that question, normalize it, because life goes on around it. And we go back to, we're not good at guessing, but we do think in terms of months, days, weeks, put on down the minutes. And in that section on how much time is left, really people are drawn to that, and it's very helpful. And then the lower section on symptom management, it's a blurb there that says, okay, with good symptom management, people not only live better, they live longer.
And we hope that if this message gets out, that we will be getting patients admitted earlier, so we can have much more impact on, as you said, the quality and even the length of their life.
Going over to the contact list, it has everybody on the hospice team and everybody, family contacts and caregiving contacts. What's brilliant about this page is I tend to fill it out as I'm going through the hospice admission, because it does a lot of things. It explains to them that this isn't just the nurse that comes in. And oftentimes the social worker does the admit. But it really shows that it's a team approach, that there's a hospice doctor in charge of a lot of the symptom management, the chaplain, the social worker, the volunteers, as with the aides as well. And then it's also a good time filling out the family section. Who are the key players? Who's really, because oftentimes it's the neighbor that nobody knows about. And then a trick I've used is when I've filled it out, I take a picture on my work phone so that I have that information when I'm filling out my admin.
That's such a great idea. I don't do that. I think I'll start doing that.
It's helped.
Great.
Absolutely. And is this mostly intended for patients in the home?
Well, Yeah, it was designed for patients in the home, and in the home it's used as the centerpiece. But what we see where it's really helpful, we have more and more people in facilities, and for the family to have access to the booklet when their loved one is in a facility being taken care of, they know what to expect, they know what care needs are to be expected, and it also helps the family have help them advocate for their family and know what a standard should be addressed.
And I'd like to mention that this booklet is actually being used. We use it in facilities because we actually are educating caregivers in facilities.
Yes.
We are doing in-services for their staff at times, or they can take this booklet and use it as the centerpiece for teaching their new staff how to actually do caregiving.
We're getting asked all the time, will you do an in-service during our meeting to, you know, educate some of the staff? So it's in some ways a marketing tool as well.
Exactly. Okay,
Wonderful.
Sarah, I guess we're ready to go to that next section, which is a very important section, of course. Hospice patients, almost all, generally use medications. We all use medications, and they're powerful medications. So we highlight medications right at the beginning of the book because it is such a large part of the treatment. After that hands-on treatment, we often use medications, and we want them to be handled with confidence. We want to reduce the anxiety of the family of using these medications so the patient gets the comfort that they need, because it's often the family who's using them who are afraid to use them, and the client doesn't get what they need. So as you'll see, it is, again, this is where we're going to highlight the main organization of the book. You can see that we have the goal, what to know about medication management, and what you should do. We highlight very simple things as to how to set up an area for medication, right, so that everyone can see the meds, know how to handle them.
Yeah, it was such an important topic. We did, one of our short videos is demonstrating how do I organize the meds in the home? How do I crush a pill into a liquid? And how do I do oral care? So, and that video is often used by nurses as we're mentoring new nurses who don't know how to go into a home and set up a medication management system.
Even some of the seasoned nurses that we've asked to watch it are surprised. If you haven't had experience with end-of-life medications, they're quite different. They're almost all sublingual, and they take specific ways to manage them. So we are finding that even seasoned nurses get information out of our video. And if you'll turn the page, Sarah, you'll notice that we've included some really important forms here. The first one would be where the scheduled medications are listed specific to that patient's needs. Down below, all of those PRN hospice meds used for symptom management. And then on the following page, we emphasize that the family does not need to write down anything that's scheduled, just anything that would be used as needed, which of course then helps your case manager titrate those medications and the schedule that they're on. One of the tips we use is that you, on that first page, that you use a pencil to fill it in, because we all know that medication schedules can change for hospice patients every day and sometimes more than once a day.
Okay, so let's move on to the symptom management piece. And the first one is anxiety and agitation. We did organize the symptoms in alphabetical order, and I just think it's appropriate that anxiety and agitation is one of the first ones. And what I love about this page, first of all, you'll see it's, again, organized in the same manner. It not only normalizes that anxiety happens at the end of life, but that it's to be expected, and it takes any shame away from it. And the other thing that we really like, and through there, it's hard, you see your family member or your friend anxious, agitated, you don't know what to say. It actually gives some verbiage. How do I start a conversation? Wish, worry, wonder. I wish you weren't anxious. I worry it's getting in the way of your comfort. I wonder. And families know how to talk about. It creates openings for what they're anxious about. And then you'll see the open instruction sheet on the right-hand side is space for the hospice team to create an individualized creative instruction specifically to that patient and family.
I think we're ready to turn to the next page, Sarah, and as you're doing that, I'm going to tell you that one of the fun things about creating this rebranded booklet that we had a lot of fun with was choosing the colors that our graphic designer used. And I hope you noticed right away that we matched the colors to the symptom. So here we are on bladder, and we're on a yellow page for urine. I won't say much more about that, but notice that it gives quite a bit of information about urinating, the discomfort that can come, and if a catheter is needed, specifically how one would take care of it. And I'd just like to highlight, many patients have catheters, and to tell someone how to do it, we often as nurses have to sit and write down very specific instructions. Here it is written out step by step, really minimizes the time the staff has to take on a fairly simple, for us, a very simplistic thing that a family feels fairly anxious about.
Yeah. So on the bowels, and again, you'll notice the color change. Call me bowel queen. We hospice nurses are the best at bowels. And I think there's even a statement in there on what to know. Hospice nurses are best at bowels. And we know that so many other symptoms are related to constipation and bowel issues. And it's easy to get overlooked and not talked about, especially newer nurses. And by having this, it allows nurses and families, okay, we need some facts here. We need to track your bowels. And on page 7 with the PRN medications, you can track the bowel medications. And it really creates, bowels aren't hard to manage, but it creates this shift from treating constipation and bowel management to preventing.
And then as you go on to the next page, we're getting into a symptom that's very frightening for patients and families, and that is a shortness of breath. It's very distressing when someone can't breathe properly. And so, of course, we wanted to direct the family's attention to exactly what they could do in that moment before they call the hospice team or have to introduce medication for it. One of the things we tell all of our clients, and it might be a tip for you, is that if you tell the family, if your loved one is talking to you about their breathing, or if they are thinking about their breathing, I tell a patient, if you're thinking about your breathing, there's something wrong, you're short of breath. So we don't wait for them to have to talk to us about it. We just say, if you're thinking about it, you're short of breath, we need to do something. And here's some really simple steps that you can take. And then if those don't work, that's when you call your hospice team.
And I'm just going to point out here too, and it also sets the stage that oxygen isn't necessarily needed. Okay, so on to eating, drinking, and swallow precautions. This can sometimes be a goal more for the families because we feed people because we love them. That's how we take care of them. And it really normalizes that food and fluid towards the end of life is not as important. It puts a shift on touch for love rather than feeding for love. And really important, it talks about swallow precautions, how to test if the swallow is good. Step by step, how do I, when they are swallowing and recognizing when they're losing that swallow ability.
If you go into the next page, Sarah, what I'd like to highlight on nausea and vomiting is sometimes nausea, of course, is much worse to experience than pain. But I'd like to bring your attention to the using of the booklet. And as Brenda said at the beginning, when you're admitting a patient, we are not asking them to read the booklet all at once.
No.
We are not introducing every key element. We are finding out what their major symptom problems are. So say a patient is the only thing they've got going right now that really needs attention is nausea. So what we will do is put a tab or a sticky note onto that page so the patient can go directly to the page that is individualized to them. They don't need to flip through the whole booklet. And you want to talk about tabs?
Yeah, so we would have loved to build tabs into the booklet, but we also had to keep the book really affordable. And so I always keep a small sticky notes with me, and whatever symptom that is most important in the forefront, I put a tab on it and I write breathing, or I write pain, or sometimes I go to the transition section and then I can move the tabs around so that they don't feel overwhelmed by the book, like, okay, I just need to go to this and read this. And then once they start having success, they're like, oh, there's so much information here. They start digging on their own for that information.
Of course, over the course of their stay, they may end up having almost every one of those symptoms. And so what I actually do, another tip, is that when I enter for a follow-up visit, I say, let's get that booklet out. And they usually have it right at their fingertips because it has become the centerpiece for their needs. And so we would actually have them go through the booklet. Sometimes I sit at the kitchen table, and then at that point, we can go through every page.
Yeah, I'm finding that I show up to the door and they have the booklet in their hand or on the kitchen table. So onto pain and discomfort. I think that's really important to identify that there's a difference between the two. And again, the eye knows where to go. What's the goal? What do we need to know what to do? And also it shows them what are signs of pain that aren't verbal. Because we hear all the time, well, they're not in pain, they're not saying, but it really, just immobility can cause just discomfort.
And of course, we know that our patients, our elders who have dementia or some kind of Alzheimer's, they often have pain that goes unrecognized because they can't express what's really bothering them.
And also, and this is a great time under the medication and the pain section, because people are hesitant, and and it reinforces, we're giving medications because they're dying. They're not dying because we're giving medications. And people can really hear that.
Exactly. Moving on to another area that can really be problematic for patients, not patients so much, but the family. It can be really distressing for a family to hear that really loud gurgling during the active dying stage. And there can be very significant secretions that are hard to manage. We find that nurses who have not done a lot or any end-of-life care really don't understand how to manage secretions. In fact, they often are they're counterintuitive. What they would do is automatically sit a patient up high, thinking that gravity is going to pull that secretions down. And in fact, they have to do the other thing. They need to put that patient in Trendelenburg, really drain out, turn them on the side, drain out all the secretions, stimulate a cough, that kind of thing. So again, we're finding that this can be utilized for nurses who are coming into end-of-life care and really have had no experience with this type of nursing.
And then on the following page, skin and wound, it's pretty simple that we really focus that it's not on about curing skin issues, but it's about containment and comfort of any wounds, but also prevention of pressure sores. And so often people are afraid to touch and move the hospice patient, and it just normalized, you need to do it. And also it's a place to say, where are those dressing supplies that none of us can ever find? It's a great place to put it right there.
Sarah, if you'll turn the page now to 24-25 for us, that's great. And we really feel like our home run is all about care is treatment. And as you can see under personal care and safety, in our first booklet, if you were one of our recipients of the booklet, you probably saw 6 pages written out specifically of how you do personal care, step by step. And we found that it was too wordy, of course, and a picture is worth 1,000 words. So we have taken all that out of this version, and now we just are really highlighting the videos. And we're using those videos, as we said, to train staff, but also sometimes we actually pick up their phone and say, let's look at it together. And you can get to our videos very easily by going to thecareplan.net, or we're highly seen on YouTube, our YouTube site.
Right. And there is a space in the booklet that talks about patient preference and notes where you can write the details. Do they want their dentures in or out? What are their favorite clothes? What do they want the TV on 24/7? So there's room for that. So it's really exciting. So Sarah, if you could move to the video section and pull up one of our videos, maybe the brief one. So
Absolutely.
This is so exciting because these videos, they really support our mission. And our mission is to transform end-of-life care through education and support. These videos were done in a very organic manner. They're not perfect, which has really worked to our advantage.
I happen to be the person who manages our YouTube site, and we get comments, 2 to 3 comments every single day on the things that we missed. Oh, you didn't change your gloves. You didn't wipe from front to back. What happened about that railing? It's great. I really acknowledge that it was organic. We missed some things, but we can tell that there are people out there, to the general public, who is getting a tremendous amount of value from this, but even caregivers who are learning new things from our videos.
And the advantage of it is when they see like the information's there. How do I do this? People are using it all the time, and it's clinical, but it's friendly and it's usable and it's realistic. And we say in there, it's never going to be perfect, because it's not ever perfect in the home. And what I want to say to you is, even if you don't buy our booklet for your hospice patients, please access these free videos. You can find them on our website, thecareplan.net, or you can find them on YouTube under The Care Plan, or Odonata Care, either one. But these videos are being very helpful, and they're free.
Exactly. Okay, I think that we missed the pages on transition and dying, which is page 26 and 27. And so we want to highlight that those are incredibly important to our hospice patients and families. It's where the anxiety starts to really build when things are really moving towards those last 2 to 4 weeks.
When 24-hour care is being really has to be there.
Yeah, and we're, you know, as it turns out, most families, if they've had no experience with dying, they are so surprised how long the dying process can last. That transitional period can be, you know, 4 to 14 days generally, even longer. But we want families to know organically, this is normal, this is how it happens, you don't need to be anxious. And I know Brenda and I both will often key our patients into this before they get there.
Yeah,
right?
what I often do is I'll set the stage to have them read it. I'll put a sticker and say, you know, you might want to read this. I think we might be getting there. Because what we find is when people read it and they see it in their own loved one, it's much easier to accept it when they've seen it rather than us just keep telling them that's where they're at.
Exactly. And then
Brenda and Nancy, I can attest to this exact what you're saying, you know, with a personal family member, you know, going through this. This is the most scariest part. And when you don't know what to expect, it just causes so much anxiety. And having this, you know, information right here in, you know, not an overwhelming amount of reading to do, but just to have it very clear and to the point is so helpful.
Yeah.
oh, thanks. Thank you very much for that comment, Sarah. And we, again, then when you get to active dying, those last 3 days, that's the really intense time.
And it's also where the magic happens. It's that time when the chaos of what can be in transition has calmed down. And it describes what are the caregivers' families' responsibilities? What do I do? It's also that time where they shift from, oh, they're going to die and it's not okay, but they feel that shift happening.
Sometimes families come together so beautifully during that time. They share stories. The patient is just beautifully sleeping oftentimes, and the family is getting to reconnect through family stories.
This is when the pictures and the stories come out, and it's a good time.
Yeah,
but it's a hard time.
And as you turn the page, oftentimes the death care is really important, and the families, many of the questions oftentimes are, how am I going to know that they died? They've never been around someone who's died, and they're very worried about what's that going to look like? How will I know? And so we speak to that directly. There are some very specific looks that will help you know that you will know. We will encourage you to know that there won't be any anxiety there. We also talk about what you could do to set up a ritual if that's valuable to
after death care.
And it sets up both that the bereavement process and some of the things that you can do to start looking at life after the death of your loved one.
The practical matters. So Sarah, if you can, I don't know if you have a copy of our tips for use, but I'm just going to talk about some general, and we're going to put out a short video for people to, to watch so that they can say, so what are some of the tips we've learned? Nancy and I have been using this book for over 2 years now, and we've have our own experience. We've had a lot of feedback from a lot of nurses using this book, and we found consistent things to do. One is go slow. Don't expect to hand this book to them and have them read the whole thing. Saying that, when there's a hired private caregiver in a home, I set a standard. I expect you to read this whole book. They're being paid to be there. We want the very best care out of them. And I do it in not you have to, but this is going to help you do the best job you possibly can.
And this is a great time. I mean, a lot of times they have a lot of downtime. A patient is sleeping at that point.
Yeah.
Perfect time to educate themselves and even watch some of our videos.
Yeah, we've got
too.
a lot of followers by that happening.
Yeah.
And also, we've also learned that using the tabs and having the tab be mobile and so that they could just one or two things at a time, like the transition, when we're getting, I see it kind of inkling along, just have a look at that. We're not there yet. And people love hearing, we're not in transition or active dying yet, But when we get there, it sets the stage.
Yeah, and you can just actually tell them, you know, I know what my homework is for, I'm going to go and order your meds. I'm going to do this and this and this. Your homework is to read blah, 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 whatever it is, so we can talk about it at our next visit.
Yeah, what I often do too is in the instruction thing, where the blank page for instructions, I start at the top, I write the date and what the instruction is, 1, 2, 3. Well, that's going to change as it usually does. I just put a simple line through it, date the next one, so that there's a running log. So the family, the hospice team who's not looking at the care plan on the computer, they can see what has happened. What we're also finding too is there's so many good seasoned hospice nurses who have been out there doing this so well for so many years.
And none of us like to be told what to do.
Right. And we recognize that, and they do a good job.
Yeah.
But here's what's happening is when it's in the admission packet and it's pretty and it's purple, people are pulling it out and like, oh, wow. And they pull it out. And some of the patients pull it out.
Families do.
Yeah. And then they're bringing it to these seasoned hospice nurses. And what they're figuring out is, this is saving me a lot of time. I'm not having to have that same conversation. We can jump to the important pieces. And so these nurses who do a beautiful job, it's like, I just found a time saver.
Absolutely. So I guess we want to speak really directly now to the benefits of what this is to your specific hospice organization. And as Brenda said, we've been using this for a couple of years and we've been collecting our own data regarding its use. We really can't share our proprietary statistics from our own company, but we are both call nurses. We're on every week. Brenda's on Monday, I'm on Wednesday, 24 hours a day. And we have seen very specific changes in our experience as call nurses. There were fewer calls. In fact, we're making less money being on call. And the quality of the questions that are coming to us as call nurses is quite different. The families are coming up with much more sophisticated questions. They don't need to be told everything. They just need to basically tweak what's happening or have the next step spoken to. We don't have to go through the basics with them. They've already know those things. So our time spent is much more individualized to them and they feel cared for. They feel like their personal experience with us is very much related to what's going on specifically with them and their loved one.
You know, and the other thing that Sheila brought out when she saw the care plan, the first version, she goes, oh, it's a care plan. She goes, and it meets all the CAP score questions, which I've been a hospice nurse for over 30 years. I've never read the CAP scores. So Nancy and I pulled it out. We read all 46 questions. The care plan booklet answered every one of those questions because we wrote it based on how we practice, not based on CAP scores, but we're finding when we go to our monthly meeting, we're seeing those CAP scores increase. I can say, because we go to our monthly nursing meetings, they're going from the 80s and we're consistently hanging on the 90%. And we all know that's how we're being paid now.
Right. And in our company, which is large, we're noticing that we are holding the highest scores because
division.
Our staff is using it very consistently now, partly because we've been, you know, Nancy and Brenda, the dog and pony show, pushing the booklet. And so people really are utilizing it and the whole organization is finding out about its benefits.
So on the very back page, Sarah, if you could switch to that. Nancy and I, we knew we had a good thing, but you know, what do we do with this? Well, we sent this off, the very first version, to both Dr. Susan Block and Dr. Ira Byock, big names, as we all know, in the hospice and palliative arena. They both immediately and overwhelmingly were like, this is wonderful. They gave us their full endorsement with each version. They've re-endorsed like this. It's just getting better. This is great. We need this out there. And we're really proud of it.
We were very proud of it to be seen by them. If you go to our website, you will also see testimonials specifically from our medical doctor. She is our medical director, and she has seen how it has improved her so much. Her practice made it more easy for her. And there's also a video of our actual triage nurse who is using the booklet right there during when a patient calls. She'll ask them, please grab that booklet. What did Brenda tell you about pain management? What was her last entry? And then she can start right where the care plan, right where that patient is, and move forward from there. And I see that Sarah is now on our website. And so if you could go back to the tabs, and you can see how many other things that we,
Exactly. So, first of all, it's an overview of the booklet, testimonials, how to bank an order, but it also goes into what does it mean to voluntarily stop eating and drinking? What is physician-assisted dying? How do I do advanced directive? It sent you to a link. How do I do a pulse? We created a contingency form that's wonderful. It's all that information that you need to gather really before somebody dies. Where's the safety deposit box? What are the insurance numbers? So it creates a smoothness. And there's also, we had started writing a book, and there's 5 short stories on the very back page that people have really enjoyed.
I guess we want to get to the closure that we're very excited about, and that is we have some special offers to you people who are doing this care that we are so passionate about, hospice care in your own communities, and we are wanting to support you, your patients, your staff with this booklet. So we have come up with some offers for you. First of all, we're very excited to announce a pilot project that has been developed for us, and we are looking for 10 companies out there who want to partner with us to use our booklet for free. We are willing to send you 10 free copies with your commitment to choose 1 or 2 nurses who want to use that booklet from the admission through 4 weeks of care, and then answer a very short, easy 6-question evaluation tool. We're trying to collect some data, and we want you to get some free booklets to help us do that. And then you can see firsthand if this booklet is good for you.
It's going to be a win-win for everybody.
Exactly.
So, of course, we would love to have your order for our booklet today, because we realize this, the care plan is going to become the new standard of care to improve hospice care in the home. We want to get this in your hands. And this booklet, it's only $3.50. It's sold in boxes of 110. And if you've watched this video and you want to buy the booklet, anywhere from 1 to 9 boxes, we'll give you a 10% discount on your first order. And if you want to buy 10 or more boxes, we'll give you a 20% discount on your first order.
And I want to intervene and say how affordable $3.50 is when you consider how much it costs for 1 triage call in the middle of the night, or some nurse that has to go out and do a visit based on symptoms that were not managed. You can see how the cost of 1 small booklet could buy you a box or more.
Yeah.
So we just want to reiterate that we have those 3 offers for you. Number 1, please be one of those 10 companies. We'd love to partner with you to gather some educational or some data for us and give you the booklet. And then that 10% and 20% discount. And by the way, if you want to order and get the book, the discount, you do need to email us directly at info@thecareplan.net, because if you went on right now and ordered it by the book online, there isn't a place for that discount.
Yeah, just let us know you watched the video.
Let us know you watched the video, you want the discount, and we will absolutely get those books in your hands with the discount. One of the other things I wanted to mention is because originally there was confusion about the change in our company brand, and we have not changed our company name. It is Odonata Care. Odonata is a hard word to remember, but we chose it for a very clear reason. Odonata is a Latin word, and that Latin word means dragonfly. Dragonflies are the symbol of transformation, and death is a transformational experience.
It really is. And years of experience have taught us that we all die like we live. And it's important to live well and live with passion. And writing this booklet has really been that for us. We have grown from it. We have transformed from it. And we want to have a bigger ripple effect. And we just hope that this booklet can help the hospice team, patients, families ease their way.
Please visit our website for all of the things beyond the booklet that we offer in our mission, and it is thecareplan.net. And certainly if you have any questions or comments after viewing this, please write us at info@thecareplan.net.
Yeah, and we want a special thanks to Sheila Clark, CEO of Shapka, for seeing the value of our book and what it really meant. And then Sarah for also she quickly, as a layperson, far as medical, got so on board, recognized it, and she has technically helped us put so much together and walked us through things.
Sarah Doricott,
Yes,
actually.
yes.
She is the Director of Membership, Programs, and Services for CHAPCA.
And we're so grateful to her.
We're so grateful. We so thank you for your attention and all that you're accomplishing in your own hospice arena. Thank you for being with us.
Oh, thank you, Brenda and Nancy. This is such a wonderful publication, and I'm so excited that we're getting it into the hands of providers here in California. And of course, CHAPCA wants to help you with that. So we welcome you back in 2022, and where you're going to do a webinar for our providers, and this will cover, talk a little bit about what you're going to go through in that webinar, if you will.
So, you know, we've been talking about this for a while because Nancy and I do a lot of education to newer hospice nurses. And so what the idea is, we're going to go through the booklet and we're going to actually do education on hospice care, symptom management, some of the meds we use. The meds are always directed by the hospice physician, but we wield those in a number of different ways. How we use the medications, tips on symptom management. When I talk about bowel care and making a mental shift from treatment to prevention and what that means. And it's just that we have so much education, our years of experience. We want to share that education and give more depth into the symptom management.
Exactly. It's almost like a crash course in how to be a hospice nurse. And we find all of you out in hospice know that it's really hard these days to find seasoned hospice nurses. There aren't very many out there. So we have nurses who are coming in without any experience in end-of-life care. They want to become a hospice nurse. They don't really know how to do it. So this is going to perhaps help you with recruitment or even train your new nurses who have come on without very much hospice experience.
And it's not just all about the symptom management. Nancy and I are both ACT trainers, which is advanced communication trainers. And we give you skills and verbiage. How do I have that goals of care, end of life conversation? How do we realistically talk about what's happening in a way that can be heard and that's gentle but very clear?
And that's a skill that nurses, if you haven't had that experience, it's frightening to talk about someone's coming death. So it's really helpful to have some verbiage so you can get started doing that for yourself, because it can be really scary.
Yeah.
Fantastic. Well, we look forward to that webinar in 2022, and we'll get that information out to everyone. Thank you all for joining us today. And again, if you have any questions, you can email Brenda and Nancy, and have a wonderful day.